Awesome. Thank you so much, Kristen, for having me and for everyone for being here. So as Kristen mentioned, my name is Marissa Rubinsky. I work as a substance use response facilitator for the McHenry County Department of Health. And I also facilitate the coalition or work group for McHenry County on substance awareness. And so we meet once a month just to kind of discuss substance use trends, what we're seeing, and we work with various agencies throughout the county that work on substance use topics to kind of direct some initiatives on what we're going to do, reflecting on those trends we see. So just to briefly go over what we will cover today in the training and the presentation. So we will be talking mostly about prescription safety. So we will be talking about how to obtain medication safely, because I know sometimes there's some confusion, especially with the internet and being able to purchase things online. We will have some information on tools for prescription safety. So that means for maintaining a prescription schedule, security of prescriptions, and then also disposing of medications properly. And then we will also talk about the other side of prescription safety in response. So if you were to notice some symptoms of medication overdose, we'll be able to recognize those. We'll be able to report accidental exposures or overexposures to medication. And then we will also be able to respond to an opioid overdose with naloxone. So starting off with obtaining medication safely. So some safe sources include licensed prescribers, so a doctor, your primary care or specialists, and then pharmacies. So pharmacies that are registered, usually the big box pharmacies are very common. So Walmart, Walgreens, CVS. I'm not sure if Rite Aid is still a pharmacy, but I know it is maybe in some locations. But also Jewel Osco, anywhere that has licensed pharmacists behind the counter. Unsafe sources would include borrowing prescription medications from a family member or a friend or neighbors. I do hear of that happening quite often. A lot of times it is with good intention, so it's not commonly a malicious transaction there, but it is still unsafe. This is just because if it is a prescription medication, it is usually tailored to that person specifically, based on any conditions they may have, body weight, other genetics that might be involved, and also depending on their environment as well, where they live, where they work, things they might be exposed to. So exchanging medications in that way that are not prescribed to you can be very unsafe. Additionally, websites that are selling medications online. So I put medications in quotations because a lot of times these are not legitimate medications. They are either completely placebos that have no effect whatsoever. It's kind of like that sugar pill technique. Or it could be something that's a bit more malicious, might have some dangerous ingredients involved. And I do also want to clarify, websites that are selling medications online does not include licensed pharmacies that are offering online refills. If it is coming from a licensed pharmacy and you're able to order that medication online as a refill, that is completely safe. But if it's somewhere like Amazon or some website that ends in a .com, I would be a little bit more cautious with those. Some tools for prescription safety, maintaining that prescription schedule. So some of these may seem obvious or very familiar as well. But for some, there may be some tools that could be helpful with maintaining that prescription schedule. Some of those are the organizer pill boxes. I know that those are very common, but a lot of times we think of them just on that weekly schedule. But for someone that might have medications that need to be taken right when they wake up or right before they go to bed, there are some pill boxes that specify the different times of day, or you can get them in larger schedules where it's a full month, multiple weeks, and those can be very helpful for some people. Additionally, kind of a bit more advanced, a lot of people still have not seen these yet. They're not quite as common. Bottle caps with digital timers on them. So these are very helpful for making sure that you did take your medication at the correct time. I know for myself, there are plenty of times where I am not sure if I took it and I have to go and check. Um, Having that timer on the actual prescription bottle can be very helpful to make sure that you know I've had an hour and 13 minutes before since I've last opened this bottle to take my medication. A bit simpler version of that is using a kitchen timer or an egg timer. You can do that as well. That kind of lets you know next time you have to take it. Um, and then, of course, keeping a log or journal of the times that you take a medication. Um, and then you can also have different columns that list off if you had any reactions that you can present to your doctor as well. So that can be very helpful. Additionally, this kind of goes both in hand with schedule maintenance and also safety maintenance, is the medication bottle locks. So these, for the maintaining a schedule portion, can be a very helpful muscle memory reminder. So these that I'm specifically talking about with the bottle locks, they wrap around the prescription bottle and the cap, and they act as a combination lock. For some people, muscle memory is a really good tool, and having to unlock it kind of triggers that muscle memory and reminds them, I already did this, I've taken this medication, I can move on with the rest of my day. So, tools for maintaining prescription safety. Um, so, there again is the uh, bottle locks that I just mentioned. So those can be really helpful tools from deterring others from borrowing medications that are not theirs, or that they should not have total access to. Some other examples of prescription safety and maintaining that security would be baby proofing. So, a lot of times, if you have children or grandchildren and you had to baby proof your house, that can be very useful in this scenario as well, is having those locks on any medicine cabinets or places that you store medications. You can also get a full box that has that combination lock as well, that can store multiple medications and then it would have that lock on it. These tools can be really helpful for a few different situations. If you have toddlers or young children that are in your house, so children, grandchildren. Um, Also, if you have teenagers that come over, occasionally teenagers will engage in risky behavior with some medications. And so having these in place kind of keeps them from borrowing any medications that might be at their disposal. Additionally, this can be really helpful for people that have memory issues or that may potentially misuse their medication, whether that's on purpose or not. So, this kind of helps someone have a little bit of limited access to their medications, and that can be more in the hands of the caregiver. And then, of course, for maintaining prescription safety, proper medication disposal. So a lot of times one of the main questions that I get is I have a lot of leftover medications. Sometimes those are left over from a family member that has passed, or if they had a surgery but they didn't finish all of their pain medications and they don't want them in the house. There are a few different options that people can utilize to help dispose of those medications properly. The main reason that we want a proper disposal is for environmental reasons and safety reasons. Environmentally, we tell people not to flush medications down the toilet. We have learned that that does impact our waterways, and it can also impact the water supply that gets recycled into various wastewater. So we just want to make sure that we are disposing properly for that reason. We also don't want people just throwing medications into the garbage can, especially if they have pets or children in the home, that might be able to get into that waste basket. So, one of the options that we have here is the Deterra pack. So, we offer those at the McHenry County Department of Health completely free. So, these have activated carbon in them. And so, when you fill them with water and you add in the specified amount of pills, patches, or liquid medication, it deactivates it, breaking it down so it doesn't have that harmful property. And then it can just be thrown in the garbage. If a child or a pet were to get into it, the medication would not be harmful. There would be kind of a nasty taste to it, but it would not have that same effect that the medication would initially. Um, Additionally, oftentimes pharmacies, hospitals, or police departments will have drop boxes that people can drop off larger quantities of medications if they have lots, especially from a loved one. So those are really great resources to be able to access. The health department also has one thanks to the coroner's office. So right in our front lobby at 2200 North Seminary Avenue in Woodstock, you're able to drop off your medications there. Additionally, there are websites like Safe Medicine Drop that show a database of medication disposal sites by zip code. So I actually attached the QR code here, and then I will send Kristen the URL as well, just to make that a little bit easier for folks. But so you go to this website, you put in your zip code, and it shows you the nearest locations on a map. I also learned today that there's an organization called Illinois Drug Take Back that does offer mail back services as well for medications. And I will share that link with Kristen as well. But it's a really great opportunity for someone that might not be able to leave their house, but they do have medications to return or dispose of. So this is a great opportunity for them as well. So moving on, we will discuss some possible symptoms of medication overdose. So there's kind of two different categories of symptoms here. So there's behavioral signs and symptoms. So you'll notice slurred speech, noticeable impairment, confusion, agitation, or aggression, panic or paranoia, and hallucinations. That was kind of in order of seriousness. A lot of times, slurred speech is a little bit more common, where hallucinations can be a little bit more emergency level. In terms of physical signs and symptoms, some people may notice nausea and or vomiting, sweating or clamminess, change in pupil diameter. So very commonly, it makes someone's pupils very, very small in their eyes. Change in body temperature, and that's often a dramatic drop or sudden increase. So they either heat up very quickly or cool down very quickly. Abnormal breathing and heart rate. It can either be severely slowed or shallow, or it could also be rapidly increased. It kind of depends on what medication was taken. Change in skin tone is very common as well. So oftentimes turning blue or purple due to lack of oxygen if they are feeling asphyxiated. And you'll notice that a lot around the mouth and fingertips. But also occasionally that change in skin tone can be a rash. They could be turning a bit red as well. Unconsciousness and or unresponsiveness. And you may, if they are unconscious or unresponsive, you may notice some choking, gurgling, or snoring sounds. They may experience a cardiovascular event like a stroke, heart attack, or chest pains. And they also might begin to have convulsions or seizures as well in some of those very serious cases. These are very important to know in case for ourselves to be able to recognize those symptoms in ourselves and get help sooner, or to recognize in someone that we know and love. So when we do recognize those signs and symptoms, who do we call? What is the most important number to have in your phone when you have medications in your house? It is the Illinois Poison Center. So I do have it highlighted on the screen. If you have your phone with you, I highly recommend putting this number in your contacts so you can access it quickly in an emergency. This helpline is available 24/7 and can provide both prevention and treatment services. So if you have questions about a medication, there are doctors on staff that can help answer those questions at no cost. And then, of course, they're a great number to have in an emergency as well. A lot of the common calls that the IPC or Illinois Poison Center receives is the "My Child Ate" questions. That can be anything from common household products. They have heard of children eating cigarettes, cosmetics, things that they might be playing with, toys, markers, that kind of stuff. Um, of course, food poisoning comes up quite often as well. Home, garden, and garage chemical exposures, animal poisons and venoms, and then that can also be plant poisons and venoms. So poison ivy has probably been a very frequent call for them as well. And then, of course, opioid and other medication exposure. So, going off of that point about opioid and other medication exposure, we can discuss a bit about the opioid epidemic and why we have naloxone, which I will get into in just a moment. So at the national level, in 2023, we saw over 105,000 fatal drug overdoses, and most of those involved synthetic opioids. So synthetic opioids, just to give a quick explanation on those, is lab made. So a lot of times those could be legitimate medication opioids as well. Very commonly, opioids are prescribed for higher level pain management, particularly after back surgeries, hip replacements, some of those more strenuous surgeries that have those longer recovery times. Fortunately, in 2023, we did see a percentage decrease in our rates for fatal drug overdoses, and that follows 5 years of steady increases. So this was definitely great news for all of us. Specifically in Illinois, because I know that's the majority of where Elderwerks does their work. In 2023, we actually saw more non-fatal overdoses than fatal overdoses, which is a positive. When we see more of those non-fatal overdoses than fatal, that means that someone was there to respond and help that person in that moment. So that is why we actually really push that we have access to things like naloxone or to prescription safety materials and education. And then just kind of highlighting a few of the demographic information points regarding the Illinois data. A lot of those were also synthetic opioids. That's kind of the top category for these drug overdoses. And most of them occur in middle age groups. So for that middle age group section that we discussed, that can be as young as like 35 to 44, and it can go up to about 65 to 74. So just kind of looking at that top right graph that kind of shows where we see some of those spikes. And actually, the highest age category is 55 to 64, which is a surprise to many people. Because a lot of times overdose is discussed as a young person or teenager issue, but the data shows that we actually see it more commonly in that 55 plus area. Additionally, just some other demographics. We see overdoses occurring most commonly in white populations and mostly in males. Just looking at McHenry County, because that's the county that I represent, in 2024, we had 21 accidental opioid overdose deaths. Just because there were so few relatively, we don't parse out which were prescription medications and which would have been illicit substances. But overall, those accidental opioid overdose deaths are decreasing. In that year, it was 30% lower than the last 5 years. And I can say that for 2025, we are also trending lower again. So having access to these materials at home or in public really does make a big difference. And then, of course, explaining a little bit about fentanyl. So for the majority of people, they hear about fentanyl on the news, but there's not often a lot of education being done on the news because it's mostly the headlines, getting that breaking news out, and then moving on to the next story. But just to provide a little bit of context for fentanyl, it is the primary driver in this alarming increase in drug poisoning deaths, and it's about 100 times stronger than morphine. And so a fatal dose of fentanyl can be as little as 2 milligrams. So on the right, you'll see there are just a few statistics from the DEA regarding fentanyl-laced fake pills, and then, of course, pounds of fentanyl powder. I just wanted to briefly highlight fentanyl because I had discussed earlier some unsafe sources for obtaining medications as a portion of prescription safety education. Um, when I had mentioned that there are websites that do sell um, different medications online, a lot of times those are placebos, they don't do anything. But on the malicious side of things, there are websites that do sell fake medications for diet pills, focus medications, um, and a lot of times those could be potentially laced with something a bit more dangerous, like fentanyl. And so I wanted to include that in this education just for everyone's safety to be aware of that and to kind of emphasize why purchasing medications online from unlicensed websites can have those fatal outcomes and why we want to avoid those sites. And then just kind of giving a brief education on how opioids work. In general, prescribed opioids and those illegal drug opioids both do the same thing. They both relax the body and can relieve pain. That's why they're often prescribed for surgery recovery. The way that they work is they bind to and activate these different receptors throughout our body that help manage pain. Those are often found on the brain, the spinal cord, and other organs. And they help manage both the feelings of pain and pleasure. So that kind of makes it easier for us to manage pain. And so when the opioids attach to the receptors, they help block the pain signals that we're feeling. And they release large amounts of dopamine throughout the body, which helps us feel better. What actually happens during an opioid overdose is that those chemicals are overwhelming the brain and it's causing our body to relax to a point where it can be too dangerous. And they stop the body's natural drive to breathe is suppressed. So that leads to then a lack of oxygen, potential for brain damage and death if not treated quickly. Externally, what those symptoms are going to look like is blue or purple fingernails and lips, as I mentioned, could also be a symptom of medication overdose. Unresponsive to voice or touch, pinpoint sized pupils, slow heartbeat or low blood pressure, slow, irregular, or stopped breathing, and pale, clammy skin. So, one of the best tools that we have to prevent opioid overdose deaths is naloxone. Um, Naloxone can reverse the effects of an opioid overdose very quickly, and it stays in the body for up to 120 minutes. So it is very effective in managing that opioid overdose until EMS can arrive and provide that extended support. Um, I refer to naloxone and Narcan interchangeably. It's similar to how we refer to facial tissue as Kleenex. It's just the brand name, it's the one that everyone knows. But Narcan is now available over the counter in many pharmacies that distribute naloxone. They also distribute their own generic versions, which are a little bit more cost effective. Um, but I will say they still run about $40 a box for generic and like 40 to 50 for Narcan brand. Um, I will send a flyer to Kristen to send out to everyone as well that has a list of locations within McHenry County where people can access naloxone for free because we believe that having that life-saving medication should be accessible for everyone as much as possible, and we don't want cost to be a barrier. Naloxone can be used on children, pregnant women, and pets. A lot of times people are shocked to hear that Narcan can be used on pets, but the specific scenario that I like to mention is if someone just had a hip replacement surgery and they were going to take their medication and they dropped it, they're going to have a hard time being able to bend down and get that medication if they're even standing at that point. If you have a dog, a lot of times if you drop anything on the floor, they're very quick to come and get it. And so if that dog gets to the medication before the person can, it might be helpful to have naloxone on hand. Naloxone does have a very long shelf life, up to about 30 years past that printed expiration date. So as long as you keep it within kind of room temperature out of direct sunlight, it will last for about 30 years. And then there's no potential for misuse or addiction, and it will not help or harm someone who is not suffering from an opioid overdose. So oftentimes people wonder, if I don't know that it's an opioid overdose, should I still give naloxone? And we advise that yes, you should, just on the off chance. If you're not sure what medication may have been taken and you know that there could be opioid medication in the house, it's always a good idea to give naloxone to that person, because it's not going to change anything if it wasn't an opioid medication or if it turns out they're having a different medical emergency. The way that naloxone works is when the opioid receptor is holding onto that opioid chemical, naloxone comes in, bumps off that opioid chemical, and then just sits on the receptor almost like a guard dog, making sure that no other opioid chemicals can bind to that receptor. And these are just the steps of responding to an opioid overdose with naloxone. If anyone's ever taken a CPR first aid class, very similar steps. We're just adding in a nasal spray. So the first step is to identify an overdose using the signs and symptoms, which I can also send that flyer to Kristen. And then you want to make sure the airway is clear, just in case they could be currently choking on something or could choke later on. And then you want to administer naloxone. So it is a nasal spray. It does, let me go back to the other picture. So as you can see in this picture, it is a nasal spray, and it just has that piece that goes into the nose, the nozzle there, and then you would hit on that plunger that's in the middle. For most cases, that plunger will be pink, so it's very easy to identify. So you would insert it into their nose, push the plunger, and then you would wait about 2 to 3 minutes between doses. You want to also make sure that 911 has been called, either doing that yourself or directing a bystander to do so. The very helpful thing that operators are able to do is you can call 911 first, and they can walk you through the steps over the phone as well. So as I mentioned, you want to wait at least 2 minutes between administering the first dose and the second dose. If that person after 2 minutes is still not responsive, you can give another dose, but you want to alternate nostrils. This is in case there's maybe a blockage in their nose that isn't allowing the medication to reach the point it needs to. And then you would just repeat this process of waiting 2 minutes, giving another dose, until signs of an opioid overdose subside or until EMS arrives and takes over the process. If you are comfortable and trained, you can give rescue breaths between doses as well while you're waiting those 2 minutes. That can be really helpful in preventing brain damage by providing oxygen to that person. And then if you run out of naloxone, because typically each box of Narcan has 2 doses in it, if you happen to run out, you would just want to lay that person in the recovery position if you're able to. And so I do have a diagram on the right side of this slide that depicts the recovery position. But the main points of that are you want to roll that person onto their side, and then you want to help elevate their head with their own arm. It's probably going to be easier to do it on the same side that they're laying on. That's just to elevate that head. And then you weigh them over with their top leg. This just keeps them from rolling onto their back again. And this helps open their chest cavity, making it easier for them to breathe. It also prevents them from choking. And then if at any time the person no longer has a pulse, you would want to start full CPR with chest compressions if you are trained and prepared to do so. And then you would just continue that process until EMS arrives. And then just to be aware of how that person might behave if they revive after you provide care to them. So typically when someone is given an opioid medication prescription from a doctor, That opioid withdrawal timeline after they take their last dose can be a bit bumpy. Oftentimes they take their last dose and that first 72 hours is going to have the peak symptoms. They're going to feel the worst that they've felt in a long time because they're withdrawing from that medication. Over time, those symptoms will subside and they will start to go back to how they were before they were taking opioids. When someone is given naloxone, they are sent into that first 72 hours immediately, and they can be experiencing all of the symptoms that I have listed here all at once. Um, and so, part of why we want to emphasize this is it can help inform your response. We want people to respond as calmly and compassionately as possible. Um, because if someone is not feeling well and someone is panicking, that doesn't really mesh very well. And we want to approach it calmly, and then address these symptoms as they come. So they might be feeling very cold and sweaty, maybe getting them a blanket, some water, and addressing those symptoms as they arrive. Oftentimes, I get the question of legality. Can I get sued if I do give someone naloxone? And there's a law that protects you from being sued. It is now part of the Illinois Good Samaritan law. That was originally intended for people providing first aid and CPR, but they have actually explicitly written in opioid antagonists into the law so that it is clearly specified and protected. So as long as you call 911 and you provide that care, um, that person and you are both clear from any legal penalties that may result from that situation. And then specifically, I do have some things listed that are related to um, substance use for the illicit side of things. But I do want to highlight as long as they have 40 grams or less than 40 grams of prescription opioids on their person, they will not be charged with any sort of felony possession as well. And then these are just a few other relevant Illinois laws that apply to these situations. One of the ones that I think applies most would be the Public Act 100-0564. That was enacted in 2017, and not many people know about it because it is mainly geared towards prescribers. So this is actually a preventative law. It does kind of prevent the idea of doctor hopping. So occasionally that's a nickname for when people go to a licensed prescriber, ask for a medication, a prescription, let's say Oxycontin for pain management, and then they want to have more of that prescription. And sometimes they will go to another doctor to try to get the same prescription, and then they can have two doses. Um, this law enacted a database, so it does have a registration that prescribers have to put in when they prescribe those kinds of regulated substances. Um, and so they can then check. So every time a doctor prescribes, they have to make sure that it hasn't been filled elsewhere. And then these are just a few of the resources that we have in McHenry County. And then some of these are actually present in other counties as well. The Way Out program is common in a few different counties. Ours is run by New Directions Addiction Recovery Services. And then Live for Lolly is also in multiple counties throughout the state of Illinois. Live for Lolly provides more of the harm reduction side of things. They offer help to people that are actively using substances that are facing addiction. And they provide harm reduction methods. So for someone that is using injectables, they help with needles, or helping guide someone to recovery as well. So if there was someone that was addicted to prescription opioids, they would be able to help there. The Way Out program is sort of the hotline for McHenry County that helps direct people to all of the different recovery and substance use resources. And then Rosecrans is one of our main recovery and detox centers. And then most of these other resources are geared towards people that are in active recovery or that are youth, which may still be useful. So Work Core and the Break are both geared towards youth. They help on the prevention side of things. And then Stages of Transformation is for people that have been in long-term recovery and need that community piece, because sometimes recovery can be isolating. And we know that having that community, having friends that are also in recovery can help that person continue. And then this is just the hotline for the Away Out program in McHenry County. It's always a good one to have on hand in case there may be a friend, a family member that could maybe use some assistance.